This is your tips and tricks section on your Pleur-Evac. Right here, you'll notice that there are columns. There is an anti-spill capability in each of these columns so that if your chest drainage system tips over, you won't have drainage in other sections of the columns. Down here, you'll notice that this is called the diaphragm. You can put a needle inside of this and adjust your air leak chamber with the amount of volume you have in there. If you notice that your ball up here is kind of stuck at the top because your patient has had very large tidal volumes or something along those lines, you can move that back down with the fluid by pushing this black button on the top, and by doing so you'll release the ball back up, back down, and the fluid will go back down. And you must always remember to have that on suction when you perform that. So let's do that. So you have your patient on suction. You know that because of the orange indicator. You notice that the ball is stuck at the top, and you notice that your volume is very high in this chamber. To adjust, again, you monitor the suction, push the black button, and notice that your ball returns back down, as does the fluid. And then if you were on water seal, you would simply remove your suction at that time, and that's how you would fix that. And the last part of this discussion on tips and tricks is the patient care that is needed when you have a patient with a chest tube. Always remember to keep the Pleur-Evac below the level of the chest. Remember that the tubing should always be free of kinks and without dependent loops. Make sure that all of your connections are checked at every transition of care, as well as often throughout your shift, from insertion site to Pleur-Evac. And when discarding the Pleur-Evac, remember to discard in the red biohazard bin.